You hear the term total body a lot because there is a mind and body connection, as we all know. Total body chiropractic, that's what they are about. They do it naturally. And I am joined by two experts in the field. They happen to be sisters, Jillian Porter and Melissa Porter. Ladies, welcome.
Thank you.
Okay, so my question to you automatically when I heard that you two were sisters, there is something in your DNA, there is somebody that made you passionate about helping others and taking away others' pain. So I'll ask you, Jillian, okay, give me the association here.
So our parents were both involved in the medical field. We're actually the first chiropractors in our family to practice chiropractic, but our parents got us into the medical background. My dad was a perfusionist, which not many people know what that is, but what he did was he ran a heart-lung machine during open heart surgery, and then our mom worked as an x-ray tech. So we've always been exposed to the medical field, but actually our mom got us into chiropractic care because she was the first person in our family to see a chiropractor, and he helped her with a knee issue that she was having trouble figuring out how to find a solution for that knee problem. It was preventing her from running, and a chiropractor was the medical professional that helped her find the solution to that issue.
Yeah, if there's ever a case of connect the dots and we'll find a problem, it's with the chiropractic field, I think. And it does help, it does wonders. I'm a huge believer. So, Melissa, let's talk a little bit about your approach. I think a lot of times people think chiropractic and they think about the spine and the spine only, but it's more than that, isn't it?
Absolutely, yes. So a lot of times we'll start with the spine because all of the nerves obviously come out of the spine and have a lot of different correlations with everything else that's going on. But it is definitely more than that. We do a lot of soft tissue work in the body as well. So in addition to the adjustments, we work on the muscles that are really tight, whether it's along the spine or in a specific area, like your knee, your shoulder. I do a lot of ankle issues and all of that kind of stuff too. So it's all connected.
I know that you both believe in natural treatments.
Yes.
So let's talk about some of those treatments and what exactly makes them natural, Jillian.
So what we do is we just don't prescribe any sort of medications with our treatments.
Good.
We're very much just about working on the functionality of the spine and of the joints. Typically, joints get, whether it's in the spine or if it's in your extremity, like your shoulder, your knee, ankle, they get locked up due to some kind of stress or trauma that occurred in the body. And so part of our job is just to assess where those restrictions are, how severe the trauma is, and then just working on naturally inducing movement back into those joints with the adjustments and, as she said, the soft tissue work, the muscle work that we use. And we just use our hands and other therapies to...
See, I'm glad to hear that because I think sometimes chiropractors, well, doctors get a bad name in that this opioid crisis. There's a reason for that. And what that is a Band-Aid. Yeah, there are times when I think that is needed.
Absolutely.
But for the most part, what you're doing is just really avoiding the real issue. And you guys are trying to make someone live a more fulfilled life, to be more physically active, and therefore mentally more happy, right? So that's what we're ultimately looking at. So let's talk a little bit about the time that you spend with patients. Melissa, I was talking about you and Jillian. You said, you know, you want to address the problem. You want to handle the problem regardless of the time it takes. You know, because I've been to a chiropractor, you know, in and out in 5-6 minutes. How are you different?
Well, so literally some of the chiropractors in the area or just across the country will spend about 3 minutes with you. I mean, that's about as long as the actual adjustment takes. So sometimes they'll have, you know, everyone along the tables, bam, 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 you know, just getting them all adjusted. And we spend a lot more time, usually it's at least about 15 minutes or so, really assessing the spine, assessing what needs to be done on that particular day, doing the adjustment, checking that we did the right adjustment, redoing it if we need to, and then doing a lot of soft tissue work just to decrease the tension in the muscles. And sometimes we do have therapies in our office as well. So sometimes some of the patients will elect to have some of those extra therapies, and that does take a little extra time as well, but really gets into more of that deeper healing and helps them feel better a little bit faster as well.
Yeah, when you think about misconceptions about chiropractic work, I think one of the things is that, you know, you've been in an accident or something physically traumatic happened to you, and sometimes that is the case, right,
Absolutely.
Jillian? But let's talk about something that is prevalent today, which is stress, whether it be, you know, COVID, the current political environment, whatever the case may be. Stresses are real, and that does affect you physically, right?
It does. Stress is around us all the time from various different sources, and a lot of times just the stress of your job really can cause a lot of tension in the neck, the low back area specifically, and that's typically posture related. When we get stressed, we actually start to assume a stress posture. Our shoulders can kind of come up to our ears and we get really tense and we're just trying to get through the day, and that causes us to adopt a certain posture that is stressful on certain joints and muscles in our spine. And before you know it, that's how you start developing some neck pain, neck stiffness, tension in the low back, just because of that constant stress that you're under on a day-to-day basis at your work.
That makes perfect sense. And this positive snowball effect, because once you have an adjustment, when you guys can actually target, whether it be the pelvis, shoulders, because again, it isn't always the back, although it may be the back, when you can target that, people suddenly start feeling a lot better mentally too, don't they? Not just physically, they're moving better, and that kind of snowballs, doesn't it?
It does, yes. It definitely creates an overall feeling of wellness, and just not only are you moving better, but you just have a feeling really of just like, that's what my body needed, and you just feel better overall in many different aspects.
So Melissa, let's talk about who you do treat. So who do you treat? What's a typical patient? Maybe one of our viewers out there is going through some, whether it be physical pain, or they're saying there's something that is not right with me, my gait or whatever. Who do you normally treat?
Honestly, we can treat pretty much about anyone who needs us, but a lot of what we see is, office workers, people who sit at a desk a lot because they have that stress posture. Their neck kind of comes forward, their shoulders come forward, and they just have a lot of stress in their low and upper back from sitting a lot and being in front of a screen a lot. But I mean, honestly, we can treat pretty much anything that people have going on. I actually personally see a lot of pregnant women and kids, growing families in the office, just because keeping everyone healthy, even from a young age, can actually prevent issues later in life. But it's never too late to start. If you have anything that's bothering you, we would love to take a look and help you out.
Let's talk a little bit about scientific studies that show that, chiropractors, they work. What you do works, because I think, again, I'm talking about misconceptions. Old school people, sometimes they have this, I'm not into chiropractic. There wasn't enough information out there. Now there is solid evidence that what you do is very effective, and a lot of times preventative from surgery, which a lot of people, everyone wants to avoid back surgery.
Yes.
Talk about that, because I think the young ones get it.
Yes.
Some of the older people may say, I'm hesitant. They shouldn't be, should they?
No, they shouldn't be. It's definitely, chiropractic has also just come a long way as a practice too. There's definitely more modern techniques out there, and all those techniques are very preventative, like I said, at just helping you to avoid major issues down the road where you might eventually need to have a back surgery because you just let the issue go to the point where it can't be reversed back. And so surgery is the only option. But our healthcare with chiropractic is just about wellness and prevention and just keeping you healthy for all the years of your life so that you can avoid expensive procedures and permanent procedures like back surgery in the future.
It's so obvious that you two are so bonded, not just because you're sisters, but because you're business partners as well.
Yes.
And it has to be rewarding for both of you when you see patients feel better, move easier, live a more fulfilled and abundant life that we all seek. So congratulations to you. So I'll ask you, Melissa, for those who are out there who say, I need their help, Total Body Chiropractic, what's the first step? Make a call? How do you make an appointment?
So you can go to our website, which I think is on the screen right now, and obviously call the office as well. We are offering a special for any one of you guys that are seeing us on Wave 3. It's a $50% off of your first visit. Just mention that you saw us here and you get that deal. Get to save a little bit more money on your health care.
All right, Jillian, Melissa, I enjoyed it very much.
Thank you.
Thank you very much. Take care of that spine, take care of your shoulders, your pelvis, whatever the case may be. Total Body Chiropractic.